Genetics in Nursing Education. Engagement through online resources.
Genetics. It can be a tricky subject to learn, even for people planning a career in it. Believe me, my name is Pinar Rosenzrak, and I'm in the Healthcare Genetics PhD program at Clemson University. So what makes genetics so challenging to learn? It's because genetics isn't just what's underneath a microscope. It affects every doctor's appointment, every prescription, the health of every family. The more genetics research advances, the more that we can take advantage of genetics in our healthcare system. Now, who is the backbone of our healthcare system? It's nurses. Nurses make up almost half of all healthcare workers in the world. So it's critical that nurses have an understanding of genetics. My goal was to improve nursing students' understanding of genetics and equip them to be able to communicate genetics information to their patients. Our research took place in a genetics course for nursing students. We designed activities to enhance the lectures that the students were taking. For example, for a lecture on personalized medicine, which means using somebody's genetic code to determine what drug and what dose is most suitable for them, the activity was to take a sample genetic test and see what medication would be appropriate for a patient with those results. For a lecture on cancer genetics, the activity was to practice using a cancer risk calculator. So how effective were these activities? To measure this, we performed a mixed method survey. That means we asked questions that both measured in numbers the amount that a student found activities helpful or interesting, and we also asked questions that had written answers so that students were able to, in their own words, express what they thought about the activities. Now, we asked questions on 3 different domains. That was how interesting the students found the activities, how helpful they found the activities, so helpful for their studying and understanding the course material. And lastly, how relevant they found the activities and if they can see themselves applying this in their nursing practice. Looking at the class average results for this class of 118 students, students rated the most interesting activity to be the cancer risk calculator activity. They rated the most helpful activity to be a DNA sequencing activity. And when it came to relevance, they again rated the cancer risk calculator activity the highest. And on average, the results for the ratings were 4 out of 5, showing support.
Students expressed comments like, "I didn't realize how interested I was in genetics until this class. The activities were helpful for applying information. I feel like I know way more about genetics and can explain genetic processes better to my patients now."
So that means that these activities help students both with interest in genetics, in understanding genetics for studying, and in applying genetics to their nursing practice. The best part is these activities were all developed from free online resources. So that means that they're publicly available for everybody to access. And that means that nurses can share them with the public. You.
And I'll share them with you so you can learn about your genetic health. Click on this link or scan this QR code to get a list of all the free online resources we use.